A fight against a global pandemic, one that has claimed the lives of over 5 million people. Some of these deaths were due to people not having access to vaccines. The World Health Organization chief is on a global drive to bring vaccine equity in order to save lives.
Our expectation is that this pandemic, the acute phase of this pandemic will end this year. Of course, with one condition, meaning the 70% vaccination by mid this year, around June, July.
In South Africa, there is a newly launched vaccine manufacturing hub to benefit not only the country, but Africa and the rest of the world. This pharmaceutical company is part of a consortium that is on a drive to develop a new vaccine. Developed countries had been hoarding vaccines following the break of the pandemic, and South Africa knows the story too well.
We received just over 1 million doses, and then to be informed by Professor Glenda's colleagues that in their research they found that it was very low in neutralizing the beta variant, and we had then very disappointingly to start looking.
We have had a situation in the recent past where we've been talking about vaccine sovereignty, vaccine hogging, prices being manipulated and therefore access being limited.
South Africa and Africa has the support of international partners.
It is simply not acceptable that at this point only 10% of the people in Africa have been fully vaccinated simply because they do not have access to a vaccine.
And the Stellenbosch University has also developed a world-class facility to conduct genome sequencing to trace new variants.
The virus will always be evolving, and it's very difficult to contain. And when you cannot contain the virus, it has opportunity to evolve, and we are likely to see a new variant.
Meanwhile, Dr. Tedros says his talks with President Ramaphosa had shown a good commitment from him to fighting the pandemic. Ulelani Philip, SABC News, Cape Town.